Hi Lianne, we're delighted to have you here at IAEM in Dublin to talk to us about PEDS POCUS. Now, I've been a fan of yours for a while, and I've watched you develop the acronyms that you were talking about today. I didn't see your talk, but I'd be delighted to hear you tell us a little bit about what you talked about.
Absolutely. So I think the big thing when we think about the FAST exam in pediatrics and in adolescents is that really our trauma is quite different from general adult trauma. And what that means is we very rarely see isolated abdominal injury, but more importantly in our blunt trauma patients we see injuries that far surpass the abdomen specifically. So the two acronyms really translate into two core concepts. And those two core concepts are, one, using ultrasound outside of the abdomen in the context of trauma, thinking about it for thoracic trauma, thinking about it for airway conformation, intraosseous conformation, nerve blocks and fractures. And then two, using our core abdominal components within the medical patient to help decrease our cognitive load and improve things in terms of our decision making in and around patients that are undifferentiated.
We've talked today a lot about cognitive offloading and cardiac arrest when we podcasted yesterday. And how do you use POCUS specifically? So 3 specific indications that you might use it for in real life where you practice in sick kids.
Yeah, so I think in pediatrics there's huge scope to use point of care ultrasound. From a diagnostic perspective, we're using it for pneumonia because we just sort of think it's a superior test. We can diagnose an effusion, an empyema, or a consolidation all in a single test, and in that whiteout lung patient, that really makes a difference. That differentiation will help decide where they're going to be dispositioned and what procedures they need. So I think that's really key. Similarly, from a disposition perspective, soft tissue, one of the simplest scans, is really, really important because if you see an abscess there, you might choose to do an incision and drainage versus sending them home on an antibiotic. And again, we know we're not great at our inspection and palpation when it comes to those types of patients. So those are two of the areas where I think there's a huge opportunity to really provide some clarity and add extra data points to what we're trying to do.
That's fantastic. Lianne is fun, POCUS is fun, and we're here in Dublin having fun.
Right.
Thank you.
Thank you.